This patient was referred to us for endodontic treatment of tooth number 30. Crown, according to the patient, about 10 years old. According to the patient, she couldn't even chew on the right side. Tooth hurt to everything, hot, cold, biting. So we went ahead and examined the tooth, and the diagnosis was irreversible pulpitis with acute apical periodontitis. Sometimes you get inflammation of the PDL because of the inflammation of the pulp tissue. You get inflammation of the PDL, gives you the impression that this is a periapical relucency, but if you cold test the tooth, you realize that the tooth is very sensitive to cold. Sometimes you could even have a partially necrotic tooth. And in those situations, that's when the tooth becomes kind of heat sensitive. So you know that perhaps maybe you're starting to go from irreversible pulpitis to partially necrotic pulp, and then from partially necrotic, of course, the next stage is necrosis, complete pulpal necrosis. But anyways, today went ahead and IV sedated her. She had some dental anxiety, so went through the PFM crown, and take a look. This is one PA I want to show you. So take a look here. Look at that beautiful lateral. There's a lesion right there. You see that? And this tooth was very likely when I first saw the patient, and I first saw the patient about 3 weeks ago. So in 3 weeks, the tooth had gone from very likely partially necrosis to complete necrosis. And this was actually now a periapical relucency. You can see it. I think it was starting to, this patient was starting to develop a sinus tract. You can see that right there. But you look at that beautiful lateral right into that lesion there, that lateral lesion there. All right. So that's one angulation. Let me show you another angulation. Now look at this angulation. You can see the lateral here again. Look at that. Two completely separate mesial canals, two completely separate distal canals, and tons of anastomosis. And look at the apical, all of these apical complexities that we were able to address. Look at all of that. There's so much anatomy here to appreciate. There's so much anatomy here. Look at all of that. Look at the anastomosis. So much anatomy here. Four, as you can see, 4 canal systems. Everything went beautifully, as you can see. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration.